Good morning. We're ready to kick this off. This is our hypertension workshop focusing on high blood pressure and pharmacology. Wanted to remind you all that this is an educational session, and so personal questions regarding your own medication, side effects, or dosages should be discussed personally with your primary care provider. Wanted to remind you that once you complete this session, that filling out the evaluation that you can do online that you would find on the Town of Windsor website with this workshop information, in addition to this pre-diabetes screening form, need to be completed, returned to the health department, and you can earn gift cards to Windsor Center in $5 increments. So make sure that once you have participated in our workshop, that you complete this information to earn those gift cards. I'm going to turn it over now this morning to three pharmacists who work with Hartford Healthcare, and they'll be presenting today. Kristen Marty, Anissa Georgi, and Jennifer Cesario are our presenters this morning. Ladies, I'm going to turn it over to you. The three of them are going to come on screen so that you can see each one of them. Kristen, I'll have you give a wave. Jen, give a wave.
Hi.
And Anissa, give a wave.
Hello.
In order for us to maintain our physical distancing, they're going to sit off screen so we can remove our masks and you'll be better able to hear and understand what's being presented this morning. Ladies?
All right. Good morning, everybody. Thank you for tuning in today to our presentation. We're very excited to be here. My name is Kristen Marty, and I am a recent graduate from UConn School of Pharmacy. I just graduated this past May, and I'm currently a PGY1 pharmacy resident at Hartford Hospital. So today I'm going to be kicking off the presentation. Our presentation today is going to be on high blood pressure and pharmacology. I don't think it's working. Good, thank you. So just some objectives for our presentation. So we're going to want to be able to recognize common high blood pressure medications and kind of just briefly explain how they work. We'll be defining high blood pressure treatment goals and discussing how to achieve these goals. And then finally, we'll be identifying coexisting medical conditions that are associated with high blood pressure. So I'll first be talking to you about high blood pressure medications, and then Anissa will take over talking about blood pressure treatment goals, and then finally Jen will be talking about coexisting medical conditions that occur with high blood pressure. So the word antihypertensives is sort of the medical term for high blood pressure medications. So if you've ever heard of a healthcare provider talking about antihypertensives, they are looking at these high blood pressure medications. So there's three main organs or systems where antihypertensives work. And these are the heart, the blood vessels, and the kidney. So really any antihypertensive is going to work in one of these three organs. So the first organ I'm going to be talking about is the heart. So one class of medications is calcium channel blockers, and these medications work by preventing calcium from entering heart muscle cells. And the heart needs calcium to contract and form these like heartbeats. So by preventing some calcium from entering the heart muscle cells, we're reducing our heart rate and ultimately also the force of heart contraction, and that's going to help lower blood pressure. So some common examples of medications that work in this way would be diltiazem and verapamil. Some side effects of these medications would be headache, and then two that are kind of uniquer to this class would be leg swelling and constipation. So if you do have any of those side effects from one of these medications, it might be a good idea to talk to your healthcare provider just to let them know that you're experiencing these. The second class of medications that work primarily in the heart are beta blockers. And these medications work by reducing how much work your heart has to do. So they reduce the workload by lowering your heart rate and ultimately lowering how much blood your heart pumps out. So some common medications of these beta blockers is they all end in the same few letters, the OLOL. So atenolol, bisoprolol, carvedilol, labetalol, and metoprolol. These are a few of the many beta blockers that are available. So some side effects, because this does reduce heart rate, you might experience a dangerously low heart rate from this medication. So that's something that your doctor or your healthcare provider will want to monitor. Some other common side effects would be fatigue, dizziness, and then one particular side effect that might be of concern if you also have diabetes would be these medications tend to mask signs of low blood sugar, specifically signs like your hand tremor or like a fast heart rate. So that's something to keep in mind if you do have diabetes and are on one of these medications. So those are the two main classes that work in the heart. So next I'm going to move to the blood vessels. So calcium channel blockers are also medications that work in the blood vessels. So there's a group of calcium channel blockers that work in the heart, and then there's a group that work in the blood vessels. So the ones that work in the blood vessels are going to be the amlodipine, felodipine, and nifedipine. And kind of in the same way as working in the heart, these medications prevent calcium from entering your muscle cells that causes contraction. So by preventing the blood vessels from contracting, we're going to prevent high blood pressure. So these medications kind of open the blood vessels to allow more blood to flow through, reducing the pressure that's within the vessels. So some side effects of this class of medications, one of them is flushing, and that's because, it's kind of opening the blood vessels. So when you do that, there's more blood flowing through. So, for example, your face might get, have like a red flush to it. And then the same side effects as I mentioned previously, the headache, leg swelling, and constipation with the calcium channel blockers. Our next class of medications is the ACE inhibitors, and that stands for angiotensin converting enzyme, and that's essentially just an enzyme in your body that, when it metabolizes certain products, it causes high blood pressure. So we're working by inhibiting this enzyme. So these ACE inhibitors work primarily in the blood vessels to relax and open the vessels, and they also work in the kidneys to help lower blood pressure. So some common examples of these medications are anazepril, enalapril, lisinopril, quinapril, and ramipril. There are others, but these are the most common. Some side effects with these medications. So some patients may develop a dry cough when they're on these medications, and it's just sort of like a pesty cough. It's nothing, you're not coughing up anything, but that is related to the way that these medications work. So if you are on one of these medications and at any time you sort of get this persistent dry cough that doesn't seem to go away, then you might want to consider switching medications, so you can talk to your healthcare provider about that. Another side effect would be high potassium. So your healthcare provider will likely want to continuously monitor your electrolytes like potassium, and you'll probably have to go for frequent blood tests. Renal impairment could be another side effect of this medication. And then finally, one that's pretty rare but can still happen is like an allergic reaction that causes some facial swelling. So that is a pretty concerning reaction. So if you ever feel like that might be due to your medication, definitely want to seek medical attention. So our next class is going to be angiotensin receptor blockers, or the ARBs, and these work very similar to the ACE inhibitors that I just talked about. So these medications also work in the blood vessels by relaxing them and increasing, they're opening them up to ultimately lower blood pressure. So these medications are losartan, valsartan, irbesartan, olmesartan, And like I said, this class of medications is almost identical to the class of medications that I've talked about previously. So it has the same side effects that I had mentioned earlier. I would say, though, that the side effects like cough and facial swelling, they're probably a little less common with this class compared to the ACE inhibitors, but it's still something to consider that it is a possibility with these medications. Another class that isn't used very commonly is the alpha blockers. And these medications work in the blood vessels by reducing the muscle tone, specifically in our arteries, to open these blood vessels. So examples of these medications would be doxazosine, prazosin, and terazosin. And some side effects of these medications would be headache, dizziness, and low blood pressure, because we're opening the blood vessels. So, reducing the blood pressure might cause you to get dizzy. So that's something to, pay attention to. And some other medications that don't really fall into a specific class would be like clonidine and hydralazine. Essentially, they work the same way as all of the previous medications that I've been talking about, by opening and relaxing the blood vessels, ultimately to lower blood pressure. Okay, and the final organ that I'll be talking about is the kidney. So diuretics work in the kidney. They're commonly referred to as the water pill, which is a name that's been given to this medication because it really increases the amount of urine that your body produces. So, most people have to end up using the bathroom a lot more. So these medications really work by like kicking your kidney and starting them, kind of like turning the faucet on. So they help your body get rid of excess water and salt and other electrolytes too, by increasing how much you urinate. So there's a few different classes of diuretics. So there's the thiazides, for example, hydrochlorothiazide or chlorthalidone. There's potassium-sparing diuretics, like spironolactone or triamterene. And then finally, there's loop diuretics like furosemide, torsemide, and bumetanide. This class of medications does have a few counseling points that I would like to point out. So first of all, because your body is getting rid of a lot of water and other electrolytes, your healthcare provider will likely want to frequently monitor these electrolytes by doing frequent blood tests to look for sodium, potassium, magnesium, calcium, among other things. Another counseling point would be these medications, like I said, do tend to make you use the bathroom more often. So it's the best if you are able to take this medication early in the day so you can avoid having to use the bathroom overnight. So a general rule of thumb is typically to take it no later than 4 p.m. Obviously, if your healthcare provider requests you to take it later in the day, then follow their instructions, but generally it's a good idea to take it earlier rather than later in the day. And with these, because you are going to be a little bit volume depleted because you're getting rid of all this extra water, you might feel lightheaded or dizzy when taking this medication, especially if you're laying down in the morning. You wake up, kind of just going from laying down to standing up exacerbates the dizziness that you might feel. So if you're doing that, if you notice that, just take your time as you're getting out of bed. Okay, so that's all I have about the classes of medications. I'm going to turn it over to Anissa now, who's going to be talking about blood pressure goals. Thank you for your time.
Hello. So just a brief introduction about myself. I actually graduated with Kristen at UConn, and together we both started residency in late June. So at this point of time, we are PGY1s at Hartford Hospital. So during this part of my presentation, we're going to talk briefly about some blood pressure goals and how we can achieve that blood pressure goal. So just a brief understanding about blood pressure. When you go and take a blood pressure, you typically get two readings. So the first reading is called a systolic blood pressure reading. And basically this number kind of shows us the pressure that is being exerted on your blood vessel when the heart constricts. And the bottom number is called your diastolic pressure. And at this number kind of tells us the pressure that is exerted on the blood vessel when the heart relaxes. So we are looking at both of these numbers to get an idea of what the pressure is like in the blood vessels during these two periods of time. So the first chart that you see there is kind of a visual understanding of what providers look at when they first measure your blood pressure. So anything below 120 of systolic and less than 80 of the diastolic, that's considered normal. And as we progress with higher numbers is when we get an understanding of that stage of hypertension. So when you go to the provider before you're initially started on a blood pressure agent, if you get a reading of in the 130s to 139 for a systolic or in 80 to 89 of the systolic, you might be categorized as stage 1 hypertension. And as you progress, and if you ever get a reading that's higher, you come into that stage 2 hypertension. And anything over 180 and or over 120 of the diastolic, that's kind of that hypertensive crisis. So that's when you would want to seek medical attention, because that could lead to potential issues as that blood pressure rises. So there's two national organizations that providers and pharmacists typically look to for guidance on how to treat blood pressure, and those are the American College of Cardiology and the American Heart Association. And those are also, they also have patient-friendly website you can visit to get more information on what healthcare professionals are also looking for when treating hypertension. So the goal that they've set for all patients is to have a blood pressure target goal of less than 130 over 80 once you are introduced a new medication. Some providers may feel that they might want you to have a different blood pressure goal. So it's good to bring that up on your visit, just so you have an understanding of what your provider wants your goal to be, and how you can achieve that goal. So I'll be giving you 4 tips on how to achieve your blood pressure goal. So just a brief overview, we'll be talking about ways to engage your healthcare team, and ways to take your medications faithfully, and monitoring your blood pressure, and making healthy decisions. So these are 4 main tips that I think would help you achieve that blood pressure goal. So the first one, engaging your healthcare team. So you want to make sure that you're engaging all of your healthcare professionals, whether it's the pharmacist at your local pharmacy where you pick up medications, your primary care provider, your specialist that you visit for other issues. You want to make sure that you're addressing that you are on a hypertension medication, and you want to make sure that you make it clear that you want your blood pressure to be within goal. So before going to your PCP, it's important to just have some questions in mind that you can bring up. For example, what is my blood pressure goal? You want to make sure that you're aware of what number you have to achieve, and you want to ask how you think is the best way to get that goal. So it's important to also mention things you're already doing to work towards that goal. So for example, are you exercising? Have you made changes to your diet? Have you been missing medications? Is there certain times where you forget to take your medications? Those are all important things to mention to your provider. So we, at pharmacists and doctors can help you navigate the solutions to those issues. And it's also very important to be honest and realistic with yourself and your healthcare team about what lifestyle changes you're ready to make. So as I mentioned, there's several lifestyle changes that are available for us to, for patients to make to get to that blood pressure goal. So sometimes it's difficult to tackle them all at once. So you want to just be honest with yourself and what you can handle at that time. So basically just pick one goal to start working towards, and you will get to evaluate how that goal is turning out with your blood pressure. And as you achieve success and build confidence, you can choose another goal to tackle. So the main point is that you want to just start with one goal and then progress and see if that's working for you, or if you need more time to go on to the next goal to tackle. It's important to take your medications faithfully. So if you find yourself not taking your medications as prescribed, you can ask yourself why. So it's important to see what are the obstacles that are prohibiting you from taking your medications. So whether that be if it's a side effect that's bothering you, as Kristen mentioned, some of the blood pressure medications do have side effects associated with them, and some side effects can bother some patients more than the others. You want to ask yourself if it's just something that you forget to take. So if it's something you forget to take, there's ways that we can go about that. So there's pill boxes, as you see on the picture, that would help you organize your medications so you can remember to take them appropriately. There's also smartphone apps that send a reminder to your phone to remind you to take your medication at a certain time. So these are just useful tools to use in case you do forget your medication once in a while. And some insurances may require that you do a mail order. So some insurances do state that for chronic medications like hypertension medications, they may want you to do a 90-day supply medication. So whether that be at your local pharmacy or a mail order pharmacy, it's important to just have an understanding with the insurance policy as well. Some patients may miss medications because they don't refill it on time, or it's not sent to them on time. So you kind of also want to be on top of those kind of issues and prevent kind of lapses of care if in those cases. So it's good to be proactive about certain medication issues. So as I mentioned, there's several side effects that can happen with your blood pressure medications. So if those are bothering you, it's important to address them, and the pharmacist or your provider can discuss the different options so we can prevent those issues that are preventing you from taking your medications. And it's important that you never stop taking your medications on your own. So blood pressure is hard to evaluate without getting that reading. So if you don't measure your blood pressure, it's kind of hard to say whether your blood pressure is high at that point of time or not. So even though you may not feel that your blood pressure is high, you never want to just stop taking your blood pressure medications because you think you have controlled blood pressure at that point of time. So that's something that needs to be addressed with your pharmacist, with your healthcare professional, your doctors, the nurses, and you never want to make that decision on your own. All right, so another important tip is that you always want to monitor your blood pressure. So you want to, you want to make a plan to regularly check your blood pressure, whether it's at the doctor's office when you go for visits or at the pharmacy. Most pharmacies have a blood pressure monitoring station that you can sit and get your blood pressure checked. And the nice thing about that is that the pharmacist is right there, so you can address any issues with them. And you can also measure your blood pressure at home through blood pressure monitoring. And later on in the presentation, we can go over the monitoring system. So it's important to just track your results in a log or diary just to monitor that progress. And healthyliving.com has this printable diary that you can start writing. So has the date, the time, the blood pressure reading, and along with your blood pressure reading, most of the time you'll also get a pulse, so you'll get a heart rate reported as well. And the time, it's important to record the time and kind of ask yourself, was this reading before I took my blood pressure medication, or was this after? So it keeps a good understanding of what your baseline blood pressure is and then how your blood pressure gets affected after you take your medication. So one more thing we wanted to go over is to make healthy choices. So there are several activities that do help to control your blood pressure. One of them being exercise, one of them being diet, and one of them being smoking cessation. And all of these can truly affect the blood pressure. So we'll just dive into some more understanding of this. So it's important to, choose the food that you are eating wisely. So you want to choose fresh fruit, vegetables, and whole grains, and you want to avoid high sodium, cholesterol, saturated fat, and trans fat. And with hypertension, we are very concerned with the sodium level. So sodium tends to increase our blood pressure. And as you saw with Kristen's PowerPoint, you saw that many of the medications were trying to remove sodium and excessive water from our bodies to kind of control, the overload of fluid in our bodies. So as a result, it's very important to learn to read food labels and choose foods low in sodium. So when you go to the grocery store, it's important to turn over to the nutrition facts and kind of give kind of evaluate what the food composes of. So you can see in the blue there, this certain food has about 100 milligrams of the sodium, which is 7% of the total daily serving. And it's important to also see the serving size. So this is intended for 2 out of 3 cups. So this whole item has 8 servings per container. However, this food label is only specific to the serving size of 2/3 of a cup. So it's important to evaluate evaluate the total consumption of the food and kind of get a total estimate of how much sodium you think you're intaking, and make healthy choices to avoid foods that have high sodium and high saturated fat and trans fat. So cholesterol and saturated fat and trans fat kind of also develop different issues that Jen will be talking about with the comorbidities associated with hypertension. All right, so I'll pass it on to Jen, who will be talking about common conditions leading to hypertension.
Hi everybody, so my name is Jen, and just a little bit about myself. I went to pharmacy school at the University of St. Joseph's over in Hartford, and now I'm doing my PGY1 residency at Hartford Hospital along with Anissa and Kristen, who you just met. So I'm just going to be doing a brief discussion about the conditions associated with hypertension. So whether it is something that is leading to the development of hypertension, or if it's a condition that develops due to hypertension. So there's a lot of different issues that may cause hypertension to develop. In particular, there's disease states that can cause changes to the body, and in particular the blood vessels in the body that lead to development of hypertension. So some of those conditions primarily include diabetes, chronic kidney disease, obstructive sleep apnea, and dyslipidemia, or also high cholesterol. And so besides the conditions, there's also other risk factors that can lead to the development of hypertension. And these risk factors are basically categorized into modifiable or fixed. And the modifiable risk factors are ones that you can really do something about and change those factors. So that includes smoking, obesity, physical inactivity, and an unhealthy diet. And the fixed risk factors are ones that you really can't do much to prevent. So that includes family history, an increased age, low socioeconomic status, male gender, or psychosocial stress. And when hypertension develops, it's basically categorized into either primary hypertension and secondary hypertension. So I just want to discuss a little bit about what those are, and when you come across the terms, if you're wondering exactly what is that, well, primary hypertension is also known as essential hypertension. And this is the most common form of hypertension, and it occurs in over 90% of patients. And this develops primarily due to either hereditary factors or direct factors, as the ones I just talked about, like diet or low physical inactivity. And then there's secondary hypertension, and this is a lot less common. It occurs in approximately less than 10% of patients. And this basically develops due to an underlying issue. So it could include problems with the kidney, obstructive sleep apnea, or it could be drug or alcohol induced. And then there's also some other less common causes. So basically endocrine abnormalities like hypothyroidism or Cushing's syndrome, or acromegaly, which is when the body produces too much growth hormone. And so when hypertension occurs and it is not controlled properly with medications, it can lead to development of a lot of other issues or downstream effects. And basically it could cause other disease states to occur. It could lead to disability, or it can even affect the quality of life for patients. And this is primarily due to how hypertension affects the body. So basically, what hypertension does is it makes the arteries in the body more stiff. So they're not really as elastic as they usually are. And it also leads to narrowing of the arteries. So blood flow is restricted, and not enough blood is really able to perfuse the organs as it normally should. So one of the main body systems that is affected by hypertension is the cardiovascular system. In particular, the heart is the major organ that we're concerned about. And so when hypertension occurs, it limits the blood flow to the heart and can lead to the development of other conditions. So coronary artery disease, enlargement of the left heart, heart failure, or even peripheral arterial disease. And then another organ that can be affected is the kidney. So, and this basically occurs due to the hypertension effects of the blood vessels that are either leading to the kidney or are located inside the kidney. And this could lead to the development of some conditions such as glomerulosclerosis, which is kidney scarring, or kidney failure or chronic kidney disease. And then also we want to think about the brain. The brain is an organ that really relies heavily on sufficient blood supply. So when blood vessels flowing to the brain are constricted and the blood supply is limited, it can result in various conditions such as stroke, a mini stroke, dementia, or even mild cognitive impairment. And then another part of the body that we really don't think about too much that is affected by hypertension is the eye. So hypertension can occur in the blood vessels that are located within the eye, and this could lead to some other conditions such as retinopathy, which is the damage to the retina, choroidopathy, which is fluid buildup under the retina, and optic neuropathy, which is nerve damage. So considering all the conditions associated with hypertension, usually when hypertension coexists with other conditions, the blood pressure goal is often based on what condition they have. So Anissa and Kristen discussed a little bit about the hypertension goals, but as you can see here, I just want to point out, so for example, in patients with diabetes and chronic kidney disease, if they have hypertension, they define the blood pressure goal of less than 130/80, and that is the case for most of the coexisting conditions for hypertension. And now we're going to open it up for question and answers.
All right. So first, we're going to have our demonstration of our blood pressure equipment, and then no, you can't see me yet. So we're going to go to big screen. We'll do the demo with the equipment, and then we'll open up your cameras, stop the recording for some question and answers. So we think that you both attended, or actually our program on self-monitoring blood pressure equipment is archived and available online to watch. Paula Rains will be back next week to talk a little bit about emergencies and urgencies with blood pressure or hypertension, but to do a quick demonstration on how the equipment is to be used. Remember to do it on a bare arm. The cuff is opened up and placed. Above that, we talked about the antecubital space, which is the inner part of the elbow, about 1 inch higher, and the tubing should be lined up with that space. Might feel a little clumsy at first as you get used to your equipment. Let's get this turned back around. The cuff gets tightened. And again, it turned on me. So getting that turned back around, getting it fastened, and then resting quietly. And Paula also reminded us that we should do this after using the bathroom. So to empty the bladder, to sit down, be quiet, not distracted. And then depending on your equipment, setting it up. This one does track 2 different users so that this information would be recorded and then easily accessible. I think as the women discussed, you could use a log or a calendar to write down the time that you took the blood pressure, to record both the systolic, diastolic, and then the pulse. Well, let's see. There we go. The blood pressure cuff will inflate as you just hold your arm quietly, resting at about the heart level. Wanted to remind you all that if you've had trouble securing a self-monitoring device at home, have not been able to find the insurance cover to purchase one, I can work with you and do have those available. So please reach out to me if that's a concern and a need. All right, I think we are ready to open it up for questions. So we can turn off the recording. And ladies, if you can turn on your cameras, then we'll be able to see you. We're getting a little help from our IT support. Well, there's Hilaria. And I think we're waiting for Avril.